During a collision from playing soccer, a patient has become unconscious on the field. First, we need to check the scene safety. Scene is safe. Next, we need to gather our PPE and approach this athlete. We need to check our ABCs, airway, breathing, and circulation, while we call for 911 and an AED from someone out on the side of the field.
C-spine with the AED. As I approach the patient, I see that he's not visually looking at me. So I'm checking for any alert or verbal stimulation. Sir, can you hear me? Can you hear me? No response. I'm performing a painful stimuli, stern rub, or a nail pinch. No response.
No response.
I'm assessing his breathing and circulation, and I'm not feeling a pulse, so we're gonna go ahead and start a cycle. So we're now gonna do a cycle of CPR, 30 compressions, compressing at a rate of 100, 120 per minute. 1, 2,
And then
3,
while Oscar
4.
is doing that, we're going to apply this OPA to make sure the airway is opened.
16, 17, 18, 19, 20, 21, 2, 3, 5, 6, 7, 8, 9, 30.
Then we're going to apply 2 breaths.
And we're gonna go ahead and reassess his pulse and his breathing. And now we have a pulse and he's breathing just fine.
Athlete is now breathing with a pulse.
We're gonna
Go ahead. We will next check vitals and proceed with our secondary assessment.
So you could check vitals while I check the head and skull meanwhile. As I'm palpating, I'm looking for any deformities, any contusions, abrasions,
Pulse is normal.
punctures, any burns, tenderness, lacerations to any of these areas, any of these regions that I'm palpating. And then I could ask him to squeeze my hands. Can you squeeze your hand? I'm checking for pulse, motor, and sensory response as I do this. What finger am I touching?
He's unconscious.
And then
Blood pressure is normal.
check the
Athlete is still unconscious, so he's not responding to cues, but we're not finding any major deformities yet.
check each leg.
Temperature and respiration is also normal.
And as I palpated his left leg, there was crepitus and a deformity to his left knee, potential anterior knee dislocation. So we're gonna go ahead and splint that before we spine board him.
During our secondary assessment, palpating the left knee, we found excessive motion in the anterior direction of the tibia in the knee joint. Now we will brace the knee
And the joint above and below.
and the joint above and below.
Can you help me lift his leg onto this? Ready? 1, 2. And we gotta put that one for the hip. Ready? 1, 2. And just slide it over. Slide it over. That's eyes, yeah. Let me just grab it.
There you go.
This is for the ankle.
As we finish bracing the leg above and below the knee joint, we can then get ready to place our athlete onto a spine board since he is still unconscious.
All right, we are now ready to spine board the patient. First, we need to put on a C-collar.
Here. C-collar is in place.
Okay, Andres, will you get the spine board? Lie the spine board on the patient's right side, and then you and Oscar are going to be on the patient's left side. Arms over his chest, legs together, ensuring that the injured side is going to be on the downside when we roll him. Oscar, I want you lined up with his shoulders. Andres lined up with his pelvis. I'd like you to cross arms. Good. On the count of 3, we're going to roll the patient towards ourselves. 1, 2, 3.
Someone in the sidelines was able to come in and help them slide that board in.
And I'm also checking the back.
All right, down on 3.
No, not yet, not yet.
Not yet?
We got an angle.
Okay.
Ready?
Down on 3. 1, 2, 3. Okay. Together, we're going to slide the patient down and then back up. So 1, 2, 3, down. 1, 2, 3, up. Good. We're going to go up just a little more, actually. 1, 2, 3, up. Perfect. Okay. Now I need someone to get the blocks.
Next, with our cervical collar in place and the spine still being stabilized, we can apply the cushions to further stabilize the cervical spine. Next, we will secure the athlete onto the board.
And I'm rechecking vitals every 5 minutes.
As well as peripheral pulses. Now that we have him tied down, we would also do peripheral pulses here.
So to repeat that, we would be checking vitals every 5 minutes because our athlete is still unconscious, as well as peripheral pulses, and making sure there's no gross edema or any changes happening near the site of injury. Go.
And we will remain with the patient, checking vitals every 5 minutes until higher level of care has reached and been able to approach us for transport.
Good.
Well done.